Welcome back, everybody. Taking a break from cooking to talk about pain management. I think, you know, so many of us have some sort of a pain and you think that's just the way it's going to be. I've got to live with it the rest of my life like that. But it may not be the case. And here to talk a little bit about it and some of the neat advances when it comes to managing pain, Dr. Michael Carl with the Neuroscience Group in Neenah. Good morning.
Good morning, Amy. Nice to be here.
Great to have you. So let's talk about some of the traditional symptoms that your patients come to you and they just, you know, have this pain and it just won't go away and it's just not fun to live with.
Amy, typically patients will present with complaints of neck pain or back pain, but there can be some complex pain conditions which can be either musculoskeletal or neurologic.
So the patients come to you and they say, you know, help, see if you can figure this out. What can a patient expect on their first visit?
Patients who come to the Neuroscience Group in Neenah will typically get a warm welcome. We'll bring them in, and an excellent group of staff will help me to get a very thorough history, physical exam, and then any appropriate diagnostic testing that needs to be done.
Lots of different options these days. You know, that's what's so cool is that you don't have to live with this pain. So many different advances. Let's talk about some of the different treatment options you guys offer.
One of the great opportunities that you can find in the Neuroscience Group at Neenah is that we cover the whole continuum of care, from physical therapy to chiropractic medicine, neurology, pain management, neurosurgeons, and orthopedic spine surgeons.
I see you brought a little tool around, or a little demo here to show us. What's spinal cord stimulation? What's that all about and how can that help with pain management?
We focus a lot with our patients on education first, and our goal in using models like this is to help you understand not only your condition but each of the possible treatment options there might be. The basic level things, including epidural injections and facet blocks, are certainly helpful for a large majority of patients. But for those who have a difficult, complicated pain condition, apparatus like this can be extremely helpful for some people. This is a spinal cord stimulator, an anatomic model, which shows how a pacemaker-like battery can be used to help drive electrical stimulation through electrode leads that are placed over the spinal canal.
So where would this get, you know, inserted into?
If a trial test shows that it provides excellent relief, this can be implanted underneath the skin like a pocket which is made over the buttocks area. And this battery can be driven and programmed by a handheld device, remote control basically.
Wow.
And with that, the advances in this technology even allow nowadays for it to adapt based upon what you're doing. If you're laying down, it can reduce the intensity, but if you're up and moving or even running, it can change to your movements.
That's amazing. What are some of the patients say about this after, you know, they've had the same pain forever and all of a sudden it's like, wow.
It's therapeutic. For many patients who have just given up on options, they've tried surgery, they've tried strong medications, and they're still struggling to move back to a fundamental life. This can help them to get their life back.
So if you're sitting at home and you're wondering, you know, I've had this pain, I've had it forever, you know, maybe I can get some help. There's new advances out there. How can people get a hold of you?
They can contact us through the Neuroscience Group in Neenah.
All right. Thanks, doctor. Appreciate it.
Thank
Happy
you.
holidays to you. I hope you're going to stick
holidays.
around. We're making beef Wellington next, and it's one of my favorites. So
Thank you.
you bet. We'll be back. Stay with us.